everybody. Welcome to Building Your Relationship with Your Doctor. We have Wendy Rodgers. She is the Senior Manager, Community Outreach and Engagement with the LFA in California. And then we also have Angelia Drake, Patient Engagement Liaison with GSK's Us and Lupus. So I want to thank everybody for being here and watching us. We're going to have kind of a conversation, a discussion about building a relationship and definitely Wendy's story. So if you have any questions, you can always put them in the chat box or unmute yourself and jump on. But I'd like to say that we are providing you information, but please check with your doctor before starting or stopping anything. This is not to replace your medical treatments that are going on right now. So Wendy, if you'd like to start with your story or your journey to diagnosis, go ahead.
Okay, thank you, Adrian, and welcome everybody. And yes, I'd be glad to share my story. I've been living with lupus now 21 plus years, and it's been a crazy, crazy journey. I could probably talk for months and months on end. But for me, it all began when I noticed joint pain that didn't really go away. Every morning, I was experiencing joint pain that progressively got worse. I'm a native Texan, so I had moved from Texas to California, and I noticed there was a huge difference in the weather, you know, leaving the humidity and the heat and all that stuff, going to California. People always think of California, I think, as this sunny, warm place, but it can actually be kind of cool. You can actually wear a jacket pretty much year round, especially in the evening. So I thought I was just trying to adjust to the difference in the weather, but the symptoms didn't really go away. So over time, I noticed that I was getting more fatigued. I just couldn't get enough rest. My hair started falling out, and I just really didn't feel like myself. My goal was not only to get married when I moved to California, but also to apply to optometry school. I was teaching and working on a master's in education, just pursuing all these different endeavors, was a young mother, and just always on the go. I hardly ever rested until one day I woke up to take my daughter to her basketball game one Saturday morning, and I could not move at all. I mean, I couldn't even lift my head from the pillow, and that scared me so bad because I had never had a major illness. The strep throat was probably the worst I had ever experienced with my health. And so I knew something was definitely wrong with me because I had been very active. I was an athlete. I was a teenage pregnancy, but had a perfectly natural childbirth and, you know, had never had anything wrong. So it was a red flag for me. And that sent me to seek medical care. And that's pretty much where my journey began. And I'll pause right there and I can go into more details from there.
Okay, well, thank you for sharing that. So how old were you when you were diagnosed to when do you think you first had symptoms?
Well, I was 27 when I was first diagnosed, or officially diagnosed. But now that I know lupus, I've been having lupus since about 15 years old. I've been having symptoms on and off. And those symptoms really kind of crossed over from, you know, adolescence and acne and all of that stuff. I used to think the acne I had across the bridge of my face was, you know, just growing up and being sensitive, having sensitive skin, but that was actually the butterfly rash. I did not know that's what I was experiencing.
Okay. And then can you share some of your main symptoms that got you diagnosed?
Yeah, definitely. So the fatigue was the big factor that I noticed. And, you know, when we talk about lupus fatigue, it's the type of fatigue where you really don't recover. You know, you never reach 100%. You always have some level of being tired. So I just noticed I could never rest enough to feel rejuvenated. And then the hair falling out, the hair loss was another big one for me because, you know, I didn't know what was happening. I was just like, my hair is falling out. It was so bad that I actually had to cut my hair short because it was thinning so bad. And then follow with that, I had rashes. For me, my rashes weren't as classic as most with the butterfly style. I had it on my chin. It was in my ears. And so I just noticed those type of things were happening right away. And with that, I noticed I was really starting to gain weight or swell. My extremities were swelling, which indicated kidney issues were involved. So those are the symptoms that kind of happen like right off the bat, progressively within a few months, just kind of piling on over time and becoming excessively worse.
And then Angelia, do you want to talk more about lupus symptoms before we continue?
Sure. So Wendy already mentioned some of the most common lupus symptoms, which are joint pain, could be a butterfly rash, or it could be a rash anywhere on your body. Lupus really affects people from head to toe. Our symptoms are all different and unique to each other. While we may share the same symptoms, we may manifest differently. Fatigue, just muscle pain and aches. And as Wendy mentioned, that gross fatigue that is just so like you can rest all night and then wake up the next morning and you still feel like you haven't rested. And that could go on for days and days and days. So it's really important to track those symptoms, even though we may think that, we might be in some kind of denial about them. It's really important to track them. And if you hang on later on in the presentation, I'm going to show you how you can get some great worksheets and tools to help track your symptoms and help you have these communications with your doctors. But there's all types of, I'm learning every day when we do these presentations, all the different symptoms that people manifest with. And I can't, remember all of them, but some of the main ones would be the arthritis, joint pain, muscle pain, fatigue, and then, headaches. People also complain of like lupus fog, which means, they can't remember their words. Sometimes they have a hard time concentrating. And so these things, all these types of symptoms can be very, very frustrating. And the only way that we can help ourselves is by sharing this information with our doctors. And if we don't track that information and bring it into those appointments, the doctors don't really know what's going on with us. And it's also really important to mention too, if you have any type of, ER visits or anything that could be part of your lupus. A lot of times, and Wendy can speak more about this, but I know with my own lupus, when I end up in the ER and I go get what I call tuned up, where, they take care of me and get me back on track, what happens is I'll forget about that ER visit and I won't mention it to my doctor unless I write it down and say, hey, by the way, 2 months ago, I ended up in the ER because I came down with something and I just could not get out of the bed, or I was in so much pain or whatever. And as soon as I get through it, then I forget about it. And so maybe Wendy wants to talk a little bit more about that, because it's not a good thing to forget to tell your doctor stuff. So I really want to encourage people to journal it, use these tools and resources that I'm going to share with you later on. So, but yeah, Wendy, do you want to speak to some of that about sharing it with your doctor?
Yeah, definitely. And that really brings me to how I even got diagnosed. The relationship, and while we're here, the relationship with the physician is the most critical piece that you have when it comes to not only being diagnosed, but managing lupus, and being proactive with your help. So I really love the GSK tools, especially the symptoms tracker. I always promote and love to share that because when I think back to even my own pathway before diagnosis, it was really important for me to backtrack. So I was initially diagnosed as a hypertension patient when I went into the doctor after having that paralysis episode, and they noticed my blood pressure was sky high. It was 225 over 125, and it just set off a red flag that, okay, something's really wrong. But I didn't mention the rest of the stuff that was really happening to me. So we didn't have a full conversation. Imagine if I would have brought something like that in, they could have seen more of a global picture of what was going on with me. And so having information like that is really important. But what I did do is after going through several treatments for my high blood pressure, I noticed that there was no change in controlling it. And my symptoms were progressively getting worse. I was more fatigued. I just noticed things were becoming more difficult for me to manage. And so I did my own research. It was funny because I still have the women's health book to this day. I've kept it kind of like a souvenir. And I ran across a very simplistic article about lupus, and it mentioned how it was an autoimmune condition that often caused joint pain. And when I backtracked my symptoms, kind of in the order that I noticed them, joint pain was the very first thing I noticed was different in my health. And I was able to tell my primary care physician, hey, I think I should be tested for lupus and this is why. And I explained, why, and kind of brought the whole picture. And that's what got me to the rheumatologist. So, that type of stuff is really, really important. And I believe, it really was the reason why I didn't go an extensive amount of time trying to wonder what was wrong with me and got to an answer.
Okay. And so did your answer come when you were in the hospital or before the hospital?
It came before. So my primary care physician had a light bulb moment, which was interesting at the time because it really indicated that, more specialists needed to be informed about lupus. He was like, oh my God, I didn't even think of that. He said, but Wendy, you need to see a rheumatologist to get the correct diagnosis because, that's out of my wheelhouse. So he referred me, and that's where I was officially diagnosed.
Okay. And then how did you interact with that rheumatologist? Did you like them? Was it an okay relationship? And then also, were you a good patient who went to their appointment, stayed on their medication, listened to your body? What kind of patient were you?
Well, I have to be honest, the first interaction with the rheumatologist did not go well. I wasn't taken seriously, and I was even told that you might be the person sitting at home looking at commercials, wondering, if you have this. And I had to really make a decision not to be upset, which was, when you're feeling bad, you're worried about your health and really afraid. That wasn't the thing that I needed to hear. But I finally said, I want you to know, I know that I'm the patient and I'm here for help. I know something is wrong with me and I really need help. And this is what I think, just based on my rudimentary, research or whatever. And I'm really concerned because I've never been sick. And so that's kind of where it started. Now, from that moment on, my lupus ended up being very, very aggressive, and I had to have a whole specialty team. I ended up fighting for my life for 6 months in the hospital, and I developed phenomenal relationships with my physicians. It was a fight at first, which I'll definitely admit, because building a team always doesn't come just like a bed of roses. It's different personalities, different specialty areas, and a lot of times specialists like to look and stay in their own lane. And with lupus, you really have to collaborate. So for example, I had kidney issues. So the nephrologist and the rheumatologist had to work together. I had a hematologist. I had all these ologists on the team, and it was definitely about coming together and looking at the situation from a collaborative perspective and working as a team, which over time was able to work out. And I ended up gaining a beautiful, beautiful family through that fight. And so I'm really honored to be here because of the fact that my doctors could come together and collaborate, and my health and my well-being, I feel like, is a result of that.
Now, did you have to kind of, oh, I'm sorry, go ahead, Angelia.
Oh,
I was just,
and I can say that I am a very compliant patient. In fact, when I was in the hospital, I was probably a little too involved because I was the type of patient I wanted to know, okay, what is this pill for? I feel this way when it doesn't. And so it was almost like, let's not tell her everything so she could just, chill a little bit, because I'm the overachiever type person trying to help them figure out what was going on. And so, I had to learn to kind of trust a little bit and then give feedback and not try to, be so amped up all the time, because, stress is a big trigger too. And you can amplify that even when you're working with your medical team.
That's such a good point, Wendy. You bring up your kidney involvement, and I just wanted to mention and have you elaborate a little bit more on that too, is, one thing I think a lot of people don't know, or maybe sometimes patients may stay in denial, is that, lupus can impact your organs. And again, it can impact different patients, and so in different ways. And so Wendy, I've grown to just love her by working with her and just really learning more about her story, because her lupus is extremely different than my lupus. And so it's really important for people to realize that, you know, sometimes lupus can attack your heart, your lungs, your kidneys. So sometimes there's invisible things going on inside our body that we cannot see, but we know something's not right, as Wendy had mentioned when she started seeing the swelling and saw, you know, she started seeing a more global picture was going on. And so, so Wendy, do you want to talk a little bit more? Because I know you work a lot extensively with other lupus patients, and you probably have more experience about different, you know, manifestations that other patients may have experienced.
Yeah, Angelia, you make a great point, and it's really important for everybody in the community to know that everybody's lupus isn't the same. There's a common pool, but you know, everybody may experience it in a different severity level or just different organs, and so lupus really is unique to the person. And you bring up another great point, which is important for people to think about is, you know, yes, I had the symptoms that were noticeable, the hair loss, the fatigue, the joint pain, but what I did not know was that my kidneys were failing. With that diagnosis basically came the diagnosis of lupus nephritis, which is when lupus attacks your kidneys. And so, you know, I even feel when I look back, I was probably having this way before I even knew it, because with kidney involvement, there wasn't any pain. There wasn't really any indicator until I saw the swelling in my extremities, which I didn't know that's why, right off the bat, that was why I was having that. So there are a lot of symptoms when organ involvement happens with lupus that you don't feel. And so having an internal specialist and looking at different things and indicators with the medical team is really, really important, because there's a huge part of lupus that, you know, is invisible not only to the eye, but even to us, where we don't see and feel the changes all the time.
And then Angelia, can you talk more about lupus nephritis?
Well, what I do encourage patients to do is to really talk to your rheumatologist about your kidney health. And some things that I do recommend as patients are preparing for their doctor's appointments, I always recommend the night before, sit down, use some of the tools. And again, I'm going to show you how you can get to those tools, but use the symptom tracker, the impact tracker, because that's going to help your doctor understand what's going on with you, as well as when you go to your doctor, if you keep your appointments. And that's why it's very important to be compliant. Go to your doctor's offices, go to all the ologists that you may have on your healthcare team, because they're looking at the invisible things that we can't see. So that's why they're drawing for labs. And what I encourage patients to do, because we know lupus does impact different organs in different people, is to find out the health of your organs. So if your kidneys are impacted like Wendy's was or is, ask them, where am I on, on the classification scale of my kidney status? I want to know more about my kidneys. I want to know more about my kidney health. And, as a patient, you have every right to understand what those lab reports mean, what all those tests they may be running on you mean. So get very close with your doctor and try to understand what those reports mean. And you remember, you are the most important person in that whole team, because you're bringing the information forward to your doctor so that they know what's going on with you and they can help you. So I just encourage you to, is exactly what Wendy is talking about, where she says, track your symptoms, share those symptoms, and just, always be on the lookout for things that might come up that might be strange to you, but it could be a very important piece of information that your doctor needs to know, such as Wendy mentioned with the swelling in her extremities.
Angelia, you bring up a great point that I want to share. In the kidney community, we have a saying when it comes to advocacy is to know your numbers. There's a lot of lab factors that you have to pay attention to. And one of the things I discovered when I met my nephrologist due to lupus, he said right off the bat, as an African-American woman, you're already more susceptible to kidney issues. And I didn't really think about that and know that. So having the health of your organs being checked is really important anyway. And I didn't know that. And so that is really important to hone in on, especially as minority women, which are the most prevalent population with lupus, it's really, really important to pay attention to that and looking at the labs and asking for those explanations. Part of the great relationship that I had with my doctors was when I had to do labs, we had a follow-up appointment where we went through the lab results, and it was explained like, okay, this is in range, this is not in range, this is what you should adjust. And so those are the type of conversations you definitely need to be having, especially if you have organ involvement.
And then back to your relationships with your doctors, because you said at the beginning it wasn't this close-knit relationship, and then it finally was. Did it feel like a full-time job for you? How did you have all your doctors understand you? How did you learn how to talk to them so you understood them and they understood you?
It was a full-time job. Lupus hit me and knocked me down, and it was a 12-year recovery. That fight in and out of ICU for 6 months was really tough. And, everybody's pattern is different. Some people go in and out of the hospital. Some people are, like a roller coaster. And for me, it was just like this big blow and then this slow recovery. And so the relationships were something I even had to work on, because at first I didn't want to offend a doctor. I wanted to be an eye doctor, and I really respected the profession of people going to medical school, going through all of the studies and becoming an expert in the area. But what I didn't know is if I did not speak up for myself, they didn't know how to help me. I would always kind of take things like, okay, take this medication, and I would leave if I would feel bad, or if I noticed something wasn't right. I never really wanted to go back and say anything because I didn't want them to be offended. And what I learned is one day I had gone in and I was taking a medication. I can't remember what it was. And I remember leaving out and I still felt like crap. And I thought, you know what? I have to go out into the world and live like this, and I still feel bad. I'm not even being true to myself. So the next time I went in, I said, you know what? I feel like crap. I know you've prescribed this, this, and this. I don't think this is working. And I think we need to try something else. And that was the truth. And even within the beginning, being hospitalized, we went through so many different treatments to try to figure out what to do to help me. Lupus is just like that. It's a lot of trial and error in many cases to see what you respond to. And I had to learn that for myself, to speak up and be honest and open with my doctors about how I was feeling, what I was capable of doing, what I was capable of affording when it came to medications. And that's where the relationship really, really, I think, it was more enriched, because they got to see who I am. In my relationships, I noticed that it was just as important to tell my doctors what I was trying to accomplish, so that they had a full picture of what my life was like. They knew I was a mom. They knew I wanted to go back to school. They knew, I was involved in the community. And so that's why I was comfortable speaking up. And so when your physicians know a little more about you as a human being, I think it makes the treatment process and coming up with a plan to care for you and manage lupus, I think it makes it more realistic to them, and they're more invested in you.
So did you ever have a doctor push back on you with that?
Oh yeah, all the
How
time.
did you handle that?
Yeah, I have, and I had to learn to be okay with speaking up for myself, and having the hard conversations, and also if you see that it's not the type of relationship where the pushback gets to the point where you're not heard. Personalities vary, and sometimes they don't match. Sometimes you have to change. I've had to do that with the doctor, and I loved him dearly. And I had to say, I think you're a wonderful clinician, but at this point, I don't feel listened to. It's not that you want to get your way, but in order for you to really not only survive or thrive with lupus, it has to be a give and take. You have to be willing to listen to a physician and honestly think about what he's trying to get you to do. But at the same time, the physician has to hear you, because in lupus, what I've discovered, especially with the clinical readings. I would look beautiful on paper so many times, but I would still feel horrible, and there's just some readings that you won't ever see on a chart. And I think physicians are getting better about that. For example, fatigue, there's no chart or way to visibly show that you're tired or in pain or things of that nature. So I've had to have hard conversations, and I've had to change doctors before. And sometimes that is the case. For me, it was very stressful to have to do that because relational stress is a big thing for me, but I was better for it in the long run because being able to communicate with the doctor is really, really important when we're coming up with a game plan on how to manage lupus.
So how did you kind of humanize yourself to the doctor so they could understand you?
Honestly, I'm the type of person, I let my doctors knew who I was. First of all, they knew who I was because I shared, for example, being an advocate in the lupus community. I shared, I wanted to be an eye doctor. I shared that. I said I wanted to be an eye doctor, but I'm a professional patient. They knew I was a teacher and a scientist. They knew my background, and I've been open and honest about that. I even shared like some of my fears, and another thing that's important, which is not necessarily for doctors to fix, but it's also important for them to kind of know what's happening in your life. For example, I had to move in with a family friend because I couldn't afford my apartment. And that was devastating for me. And I was really, really upset. So, like, if your family dynamics is changing or you lost your job, it's important to make note of that because that's a stressful time, and you might be struggling a little more than usual to do what you need to do. For example, if you lose your job and you can't pay for a medication, that's important for a physician to know because it might be a little more difficult for you to be compliant and taking the medication. That's real life. And so bringing in situations to kind of show where you are in life is just as important. Remember, it's not for your doctor to necessarily fix, but I think letting them know about it helps them to see like this is the person trying to live life. And one of the other things I want to stress is I always would tell my doctors, look, I'm going to do my very best to help myself. And what I require of you is you to do your very best to help me help myself. I need the tools for that. And so when they knew I was very serious about that, because my thing is I wanted a kidney transplant. I did dialysis for 9 years. And so I was very, very serious about staying in the best health I could be to be able to have a kidney transplant, which I've been able to celebrate my 13th year with this kidney transplant. And I'm still just as serious with managing lupus and my health and being compliant with medication. So when doctors know that, I think they, feel a little inspired and willing, to help you live your life. I know personal things about my doctors. They know personal things about me. And I think that's important in the relationship.
And then, did you ever utilize the nurses when you were going
Oh
through your
my
diet?
God, I love nurses. I love, love, love nurses. And I'll say, one of my nurses is like my sister to this day. I I had her take care of me 20 years ago, and I was on my deathbed, and this lady walked in and said, "You're gonna live, you're gonna be okay." And I clung to her for dear life, and we're friends. A couple of years ago, I was able to travel for the first time outside of the United States to Jamaica with my closest girlfriends, and she was one of them. And I told them as soon as we got to Jamaica, I said, the reason why this trip was possible is because of her, because she saw me at my lowest. And nurses really can communicate to the doctors and the medical team what you often can't. And they're one of the greatest advocates you can have because they see you and they communicate on a whole nother level than a doctor. They're like, I don't even know they're like the guardian angel for you. So tell the nurse what's going on, and they can be like the liaison to the medical team. And I've had so many angels through nurses come through, and I love nurses. I love them.
Great. So I think when we talked earlier, you talked about either starting school or going back to school, and you were having trouble retaining information. How did you talk to your doctors about that?
Well, it goes back to just making my life and my doctor visits personal. I remember I started working on my MPH, and the first class I taught, which was Masters of Public Health, I decided to pursue a third degree a few years ago. And I noticed, I'm like, I'm reading this and I know I'm not crazy, but I don't remember what I read. And I thought, this is not right. And I said, well, let me go talk to my neurologist because maybe something happened to my brain because I had had seizures and I even had a stroke before. But I'm like, let's have a conversation about this. So when I went in, I told him, I said, I noticed my retention and my ability to read and comprehend and just retain things is different. And he told me, he said, oh, I didn't know you were going to go back to school. Well, that makes a difference because the medication that you take will do that. And I'm like, oh, I didn't even know a medication would do that. So just even thinking of, where I was in life and trying to relate it to, how lupus, how medications may impact your ability to function or think. It's important to think that way. Even with my mental health provider, I always try to be open and say, hey, I want to go back to school. I'm trying to plan this and manage this. And I think it's been very beneficial, instrumental, and really helped me set realistic goals and stay in tune with what was best for me when it came to, managing lupus and making realistic choices and moves and next steps. And so I thought that was really interesting just to go and to have that conversation. And he was such a great character because he's very animated. He said, oh, I didn't know you were going, back to school. Well, I just want you to know that this medication will do this. And he changed the medication. And I noticed I was fine. I was able to do the program. I have my MPH, now, and 3 years later, here I am. But I had no clue that, medications could do something like that. So that's why I say it's important for your doctor to kind of know what you're trying to accomplish just on a daily basis or life-wise, to help make those decisions. For example, if you want to have a baby, say it. If you want to get married, say it, so they have an idea of what you're doing. Are you going rock climbing, whatever, just kind of, you don't have to tell them everything, but just kind of let them know what kind of person you are so that they can kind of say, okay, if you're going to try to do this, then this might work out better. If you're going to work, this might work out better. Things of that nature.
Okay. And then, so now when you prepare to go to the doctor, what kind of things do you bring with you? What do you make sure that you have? How do you prepare?
Me and my good old smartphone. I have a nice note section, and I've often joked with Angelia. I said, I'm really not a journaler, but when she said, oh yeah, you do, because you do it on your phone. So before I go into the doctor, even if it's just before I arrive, what I do is I just take a moment and give myself a still, quiet moment. And I write down the bullet points of what I need to talk about before every appointment. I never go into an appointment just haphazardly. I go and I make a note, like I need to talk about this. This has happened. This has happened. Even along the way, when I know things are coming up, I'll go and I'll make, note like this appointment or nephrology appointment, rheumatology appointment, and I do the bullet points of what I need to talk about. You can do it ongoing. If it's something that happened, you might want to make note of it. And that's what I open up when I get in the office. When they come, I said, okay, hold on, let me pull out my smartphone. And we do that. They open up the labs and we kind of sit there going through our devices and we go through the conversation that way. I always try to have my script or my points for every appointment.
You're on mute. You're on mute.
You're on mute, Adrian. You're on mute.
Just realized it. So before we go over to Angelia, do you have anything else that you want to talk about with your story, your journey to building a better relationship with your doctor, and then Angelia can discuss some tips and tools about managing lupus.
Wendy?
Oh, I thought she was going to you, but one thing I want to say too, with your physician, because everybody's different, a good rule of thumb too about building a good relationship with your physician is to ask them what works best for them. You can say, when I come to the appointment, what's really good for you to have, so you can have an idea of what's going on. What do you hone into? Because I know some people, they like to go and look at a specific thing. And another thing too, because lupus will evolve over time or things may change, your medical specialist may change. So for example, since I've been mainly a lupus nephritis patient for the majority of years, and that's been the top concern, he's kind of like the lead of my team. And he'll often kind of go and talk to the other physicians too on my behalf to share what he's doing. So it's important to ask your specialist or your doctor, what do they really need from you when you go into that appointment?
That's a great point. So thank you. Adrian, I just wanted to make note that Mildred, who's on, she may have a question, and her hand's been up for a little bit. So I didn't know if maybe she wanted to ask her question before I move on and share the resources. So Mildred, did you want to come off mute?
Yes, one moment. Am I off of mute?
Yes.
Mm-hmm.
Okay. I live in Texas and I just was diagnosed with lupus, and I'm having major problems because I'm going through so much as far as everything with doctors and stuff. But my thing is just trying to, I listen to her and stuff, and I try to I try to write down everything they're putting me on as far as my medicine and everything. But I have an exposure that's broke out, and they've done a biopsy and everything else. And I'm like, I don't know what's going on with my lupus. And I can't seem to get the right answer. So I'm very frustrated right now.
So
Did you?
are you looking to find another doctor, or what kind of questions to ask?
Have to. When this COVID's happened, I really had a bad spell with it. And they're sending me to specialists and stuff now, but I've been dealing with this stuff over a year now. And I have like bad sores and stuff on my body from it. And they have done biopsy and they said it's lupus, but they can't seem to get it under control. And I'm like, I don't know what to do.
Wendy, do you have a recommendation?
My first thought right off the bat is to ask for a second opinion.
Yes.
I think you do need to see a dermatologist. And I'm not a doctor. I'm not here to give medical advice, but if lupus is affecting the skin, there is a version of lupus called cutaneous or discoid lupus, which, your skin is an organ, our largest organ.
Yes.
So you want to definitely make sure you're working with a dermatologist, and even ask the doctor, are you familiar with lupus? I need somebody who really is familiar with this.
Right.
And getting a second opinion, definitely do that. Also, if you're in a group, for example, I'm in a group where it's kind of a managed type care. Sometimes they'll have like a manager where you can go in and talk and say, I'm having a really tough time getting the answers that I need, and I'm not really confident that I have the doctors who are able to answer that. Could you recommend someone else to me? For example, when I changed my doctor, that's kind of where I started. In fact, they sent me there because I was all emotional. I'm like, oh, I just got rid of my doctor. What am I going to do? I didn't know what to do next. I just knew I had kind of fired him. But I learned that that's kind of where everything started to make the changes. So if possible, try to see if you could find that type of person in the medical group to work with you.
Okay.
When you go in, Mildred, try to have, if it's not a whole binder or whatever, just kind of gather the key things so you can show the other doctors and kind of highlight and say, I was told I have lupus and it's affecting my skin. And
It is very bad.
Mm-hmm.
Very bad. I mean, I stay very fatigued and tired all the time. But I think you're right. I need to find some new doctors. I do.
I can't tell you how many times I oversee our support groups, and this is one of the main discussions we have in support groups. And people
Mhm.
are often very afraid, and sometimes it is tough depending on the medical group because sometimes people don't want you to change, but it's really important. It's kind of like dating. You got to try to find your match. It's
That's
not that you
right.
don't want to like people, but you got to find your match and build your
That's
team.
right. Thank you for your help, Wendy. I appreciate
You're
it.
welcome.
And
Good luck.
Mildred, I'll reach out to you by email. We do have a physician directory list of lupus physicians.
Okay.
So maybe they'll be able to see you at some point. So I'll reach out to you after this program.
Thank you. I appreciate it.
Yeah, and Mildred, I just wanted to add, and to the other ladies and people who are on the call, you know, to Wendy's point, I'm a nurse and I have lupus. And first of all, I had to fight my own denial with lupus to get seen. And then secondly, you know, I had to change rheumatologists also because the rheumatologist who diagnosed me was phenomenal at diagnosing me. But to manage my care, I had to change to another rheumatologist. And what I ended up doing, because I was struggling with, you know, like Wendy said, you know, you don't want to hurt someone's feelings, right? I was like, oh, great, this doctor just finally figured out what was going on. I thought I had food allergies, but I ended up going and leaning on my primary care doctor to help me go through my records and understand everything, you know. And even though I work in lupus, sometimes when you're a patient, it's sometimes really hard to move past, you know, what's going on. You just need someone to help, you know, guide you. And so if you have a great primary care doctor, you can actually lean on them also. Adrian's going to send you a list, but I love what Wendy shared, because sometimes we do have to move on to another doctor because for whatever reason, I mean, all doctors really do want to help us, but in my case, you know, mine was great at diagnosing, but the managing part was a little bit different. And maybe it's like what Wendy said, that doctor that diagnosed me may not have the experience that the rheumatologist that I'm seeing now. So I think that was a great question. And thank you, Wendy, for sharing that. And Adrian's going to be your best friend because she has a lot of great resources for you.
Good.
So
Thank you.
I'm going to show you where you can get some additional resources, and then we can come back if Adrian's okay with more questions for Wendy. But let me see if I can share my screen here. I always get turned around on these different platforms that we're doing these events on. So hold on one second. I have it right here. So let me know, can you see what I have brought up? Can you see it okay? Okay, I see people nodding. Okay, perfect. So Mildred and the other participants on the call tonight and who may see this in the future, if you have your cell phone, what's great is I've pulled up QR codes that can take you to information where you can learn more about lupus. So for example, if you want to go ahead and pull out your phone, the first QR code that I'm going to take you to, and I'm going to walk you through it. I have my phone out. I have the camera open on my phone, and I'm going to go to this third QR code that says to register for a symptom tracking kit.
Okay.
If you do that and you open it up, you should see a website that comes up. And what you can do is you can scroll down and there's a part on there where you can enter in your email address. So if you want to, everyone go ahead and do that and enter your email address and then hit submit. And what will happen is you'll start getting this tracking kit in your email, as well as you'll get other information about lupus that will help you. And the more we know about lupus and the more that we track our symptoms and kind of know what our symptoms are, what some of the triggers may be. So think about when you track your symptoms, if you're having a flare, think about what's going on in your life, whether it's stress, think about what maybe you just ate, you know. Just jot that information down because that'll help your doctor really understand what's going on with you and what your symptoms are doing and how it's impacting you as well. So I really encourage you to do that because by the time we get off this call, we may forget to do it later. So I'd say do it now. Put your email address in there. And that way, you know, in a few days, you'll start getting the tracking kit, and then you'll be on a continuous you know, email list where you'll get more information to help you manage your lupus. And the more we know, the more empowered we feel and the more confident we feel when we go in and talk to our doctors. So I encourage you to do that. The other QR codes, you do the same thing. You take your camera and you just open it up, and I'm trying to open mine again, and you get it open again, and you can actually go in and save these web pages on your camera, on your phone, and it'll take you into these great, pieces of information that can help you understand your lupus, as well as your caregivers or your friends or whoever is in your circle that is along the journey with you, because it's really helpful to have those who are in your life to understand lupus as well, so that they can support you. And if you want to do it again, open your camera again, open up the Identify Common Lupus Symptoms, and it gives you a whole list of symptoms, as well as you can click into each tab and it'll give you more information about those symptoms. And you may be surprised at some of the things, because some things that we kind of ignore, that's truly a symptom that could be related to our lupus. And that's important information to share with your doctor. And as Wendy has been talking about lupus nephritis, there is a QR code here on the far right. If you, again, open your camera up and bookmark that page, you can also learn more about lupus nephritis. And I just encourage every patient to learn as much as they can about all the lupus symptoms, as well as think about having these conversations with your doctor to find out if lupus is impacting anything internally, so that they can keep a watch on all your organs and make sure that your organs are okay. And they will always keep an eye on where you are on your labs to make sure that you're tracking along okay. So, to Wendy's point, it's really important for us to build those relationships with our doctors. If we find one that we're not comfortable with, go find another one, because you need to take care of you, and also prepare for your appointments, as Wendy mentioned, before you go in, because a lot of times when we go into those doctor's offices, even being a nurse, and I have some fellow nurses on the phone here too, even as a nurse, we may go in there, if we're not prepared, we'll forget to mention what's been going on, how our lupus has been impacting us, or any questions. Make sure to write down any burning questions that you may have for your doctor, because when you're in those appointments are for you. So own those appointments, and you be sure to share your information with your doctors and ask your questions. And that's going to help you build those relationships, as well as build your confidence and help you feel empowered, so that when you go in each time, you know that those appointments are for you, and you can get what you need out of those appointments. So I'm going to leave this up on the screen while we move on to questions from anyone. So Adrian, I'm going to pass it back to you, because we have Wendy here. She's such a great resource. And I just want patients to really appreciate and ask anything that they want with Wendy, because she's here also with Adrian to help you.
Yes, thank you, Angelia, and thank you, Wendy. If anybody has any questions, you're more than welcome to unmute yourself and just talk. You don't have to put your video on if you don't want to. You can also input it into the chat box. But Mildred, you did have a great question for Wendy, and Wendy, you definitely gave some great tips for her. We do get those calls quite a bit about patients not being able to figure something out that's going on. And so getting a second opinion is great. So if anyone has any questions, please take yourself off mute, or if you just want to make a comment, take yourself off mute. We'd love to hear from you.
Don't be shy.
Yeah, we're all friends.
And Adrian, while maybe someone's thinking of some questions that they may have, do you want to mention the part 2 that we're going to have with Wendy?
Yes. So part 2, sorry, I just put it down. So we're going to come up with part 2. We're thinking maybe we're going to hold it in October, and it will be kind of who your medical team is and how they should be helping you. We're going to go over it more, plan over it more before we send it out to everybody and get a date. But Mildred, it looks like you have another question. Go ahead.
I'm sorry to bother you and stuff. The only reason I'm doing this is because I've been diagnosed since I was in since 2018. I've been to several different doctors. I've got a primary doctor that I go to. They sent me to 2 rheumatologists and stuff. Now they're sending me next week to an infection disease doctor, only because they're saying that this stuff has affected my my blood cells and my body system. I mean, it's really been over 2 years now, and now they're saying that my pancreas is even affected. So
Wow, okay.
I'm in a situation where I'm really concerned, because it's like, I mean, I feel like some of the doctors have been, I mean, some of them that I've gone to, they're like, well, just come back in 3 months and we'll check you again. They keep putting me on antibiotics, and it will clear it up a little bit from as far as my issue, and then they'll take me off and it flares up again. So it's like, I just, I'm to the point where it's like, I don't know what else to do. I mean, I'm going to every doctor I can think of around here. So I don't know. I mean, this infection doctor is supposed to be finding out why it's exposed out on my skin and stuff like it is.
Mhm.
So,
It's really bad.
so Mildred, one thing, and this is in my own opinion, and one thing that I heard you say, are you in the Dallas area?
I'm in the Fort Worth area, Fort Worth and Burleson, Texas area.
Okay. So I would, in my own opinion, I would, offline, maybe talk to Adrian about some lupus clinics that are in this area. I'm in Texas also. And so I know she has a directory of doctors, and maybe, as Wendy had mentioned, sometimes these rheumatologists, they may not see a lot of lupus patients. And so it's really important to find a rheumatologist who sees a lot of lupus patients. And I know that Adrian has a list, and I know she knows there are lupus clinics in the area. And so that might be something that you might want to look into with Adrian, to get to a clinic where these doctors work with a lot of lupus patients. Because I will tell you, some rheumatologists spend a lot of their time with other autoimmune diseases. And so maybe that might be an avenue that you might want to explore with Adrian.
All right, Angela, thank you. And Adrian, I would like to talk to you later, please.
Oh, yes. And I've actually already emailed you the physician directory list.
Wonderful, thank you.
Yes. So
Well,
do we have an,
I was going to say, I'd love for if Sandra, not putting you guys on the spot, Sandra or Chanel would love to, you can type in the chat box or ask Wendy any questions. She's such a great resource, and she has such extensive experience in, having lupus, but she also runs the LFA support and education program in California. And so just like Adrian, they're both are phenomenal resources. And I know sometimes it's not easy to talk about your lupus or talk about things in a group setting, but we're all here to support each other. And if there's anything like questions on symptoms or anything on, exactly what exactly does Wendy put down in her phone when she prepares to go meet with her doctors the next day, please, we're here to help and want to help you and direct you wherever we can.
so back to putting your symptoms down. I'm old school. I don't have lupus, but other issues going on, but I write it down in my calendar, my paper calendar that I keep with me. That's how I like to keep track of things. And I do think keeping track of your symptoms, even if they're small and you don't think it's anything with your lupus, I think it's so important to keep track of it. Bring it up with your doctor. Don't feel like you're bothering them. You're there because they're there to help you and to listen to you. You are not a bother. So just keep asking, keep talking to them, build your relationship with them. If you don't feel like they're helping you, get a second opinion, maybe go to a different rheumatologist, nephrologist, reach out to us. We're here to help. So does anyone else have any other questions or want to comment on anything?
I do.
Okay, go
Hello,
ahead.
everybody. I've been having a lot of issues with hoarseness in my voice. I felt like at times it'll be a flare up, but not, every time seeing the rheumatologist, they say, "Oh no, that's not something that happens. It's probably just something you need to see an ENT for." Seen an ENT, and they're like, everything looks good. And it's just kind of a roller coaster of emotions of, is this all in my head? But I know it's not, because I'm hoarse and not sure if that has anything to do with lupus or what's going on. But I kind of get frustrated, and I get to the point where I don't want to see anybody, because I don't want to go to one doctor to tell me, oh, you're fine, and then go to another and it's the same thing. So what do you really do about that?
I want to share two things. First of all, to Mildred, and her situation. When I was listening to her and she was talking about, I could hear the worry and the frustration. And one of the things I want to share about writing things down, you know, the emotional part of you is just as important. So when you go into the doctor, you need to say, I'm very afraid. I know I'm not okay. I'm scared. I want to live a quality life. You want to make statements like that so you get somebody's attention. You know, I'm looking for a doctor that can recognize why I'm not okay. You know, things like that, where it just kind of almost like an alarm flag, just to kind of say, like, look, I'm not comfortable anymore. Because I feel like sometimes, you know, when you're going through all of these exploratory, trying to figure things out type of sessions, people kind of lose the fact that you're concerned about yourself, you know, and it's not okay. You know, I would be very uncomfortable. And that was how I was at the beginning. I was very uncomfortable not having an answer because I knew something is wrong with me. I might not have the answer, but I know myself, you know. And so when you go into a doctor, and same to you, Chanel, I believe that's who was talking, you need to say stuff like that. Like, I'm afraid that I'm not okay. You know, or I'm a mom and I got to be able to speak to my child, or I teach and I got to talk, you know, where they know, like, I got to use my voice, or I need to be okay, you know, or whatever. So you want to make a statement like that where it kind of jars somebody. I feel like those kind of statements help a little bit. And then Chanel, I could definitely relate to you. One of the things I did, I had this condition where my eyes would flare up and be really itchy and red, and I would want to just pull out all of my eyelashes, and it comes and goes. And so I got so tired of trying to go, when I would get to the eye doctor, it wouldn't be there. And I'm thinking, okay, I know it was there. So what I did one time is I just went into the emergency room and I said, you know what? Do you see my eye? You know, I knew they couldn't, I just wanted it on record that this happened. And so they knew this happened. So, you know, I know it could be expensive sometimes to go to the ER, and it might not be so bad of an experience, but sometimes just getting something on record or going in when it's actually happening, really pushing to get in when it's actually happening, because with lupus, things come and go and you do feel crazy. Sometimes, you know, you have an issue, but when you get there, it might not show. And an example is when I was in college, I came to California for spring break and I had an experience of vertigo. I spent my whole week of spring break going to a clinic getting MRIs, and I was told I had a brain tumor. Scared me to death. I get back to Texas, follow up, and the doctors said, I don't know who you were seeing. They must have been a quack or something. I don't know what they were talking about. Well, I really did have a problem, but it was inflammation. Fast forward, years later, I ended up having seizures and a grand mal seizures. And I had inflammation on my brainstem. It was visible, you know, when they did the scans, and that's what it was. But, you know, because symptoms and things come and go, by the time I got home, nobody saw that. And so if it's something that you know is really happening, try to go and get it documented, or have somebody see it where they can say, yeah, I did see, or she could not speak or whatever. So they can see a report of it. If that makes sense.
Yes, that makes sense. I've actually have went in both. I've had two experiences where I went in where I was not completely hoarse at all, but then it was another when I was completely hoarse, like barely talking, and they're like, oh yeah, I don't think that has anything to do with lupus, and your inflammation markers are great, and this and that is great. And I'm like, but you're hearing it and seeing it in the flesh, and it's just like, what the heck?
So that's when I asked, well, what could it be related to? Could you refer me to somebody to know where this is related? Because, you know, it's a reoccurring issue. And this is the part where advocacy kicks in, where you have to demand and be more firm and consistent with, you know, an answer. If you don't know it, you know, I need you to refer me to somebody that might be able to explain, if it's not related to lupus, what could it be? Because it's a reoccurring problem.
Definitely. Thank you.
So to your hoarseness, I actually have someone on our board who's going through a similar thing. I don't know if she's been diagnosed with anything, but I would love for you two to connect just to see how she's dealt with it. So I'll get in touch with her and then have her reach out to you. Her name is Diana.
That's wonderful. And see, Adrian's made a great point. The other thing, and this is what I love about support groups, is you can ask, like, hey, did anybody ever have this? You know, people are always asking each other. Make sure you kind of pull people around you to see, you know, if anybody else has had the experience, because usually you'll find at least one person that says, yeah, I thought I was crazy, but it, you know, I did have this happen. So make sure you also reach out in the community, even if it's just like on Facebook, say, hey, you know, I've had this happening. Did anybody else have this happening? We often see these in our educational events where people put something in the chat box to see if they could find somebody. So that's another great point. Adrian, I'm glad you did that.
Of course, I think it's really good for each other to help each other help out.
Yes, thank you very much.
I have a question, Wendy and Adrian. So Wendy, what about, what's the best guidance you've been given in your lupus journey, whether it's from a physician or a caregiver or just, you know, learning from others?
You know, I was listening earlier about the physicians, and like I said, I've had a good team, but one of my all-time favorite doctors was my hematologist oncologist. And he was like the quiet, strong, quiet type. He's retired now, and I mean, it crushed me when I had to retire a doctor. You know, he left, but he gave me the best advice, because after being diagnosed and being in the hospital, I remember going back into life. I ended up having to go through a divorce, and I was so stressed out. I was trying to move and going through all of this, and I got in a car accident and I developed the shingles. And he had me go into the hospital. They sedated me like for 2 days or whatever, made me just stop and rest. And I'll never forget when I came to, he was sitting in the little visitor's chair and he said, okay. And just as simply as it could be said, he said, Wendy, I just want you to understand 2 things. Number 1, stress will kill you. And number 2, not everything is worth fighting for. That was the best advice I've ever had when it comes to life and living with lupus. And it was like at that point in time, I realized, you know, with this disease, managing stress is very, very important. And I think that's something, especially as women, we underestimate the power of, you know, saying no and stopping to take care of ourselves. If we go back and we look at ourselves before we've had a major flare up or a crisis, we'll see in our life how we've kind of put ourselves to the side, or we might not have even been on that list of concern. And so managing stress is something that you have to prioritize. And I never, ever did that. When I look back at my life, I was a person, I was always on the go, always busy, never stopped, always had to say, do something. I was always running here and there, and I had to learn how to tell people no, or I can't do that, or I'm not available. And that was very difficult for me. And so I think that was the best advice I ever had. And then kind of piggybacking off of that, you know, I don't need to always, sometimes the way you fight is to be still and to stop. You don't have to always, like, you know, and this kind of comes from a cultural thing too. As a Black woman, we're kind of taught to be strong, fight through, you know, kind of thing. And that's not what fighting always is. Sometimes fighting is to let things go and say, you know what? that's not even for me right now, you know, and take it off the table, because then you have released yourself from some stress, you know, and so you have to really kind of look at, you know, your triggers for stress and what you can do and what you can't. And I have a good friend, he runs the man cave, and he made a great statement, which it's very simple. And I know somebody else has said it, but it was so profound at that moment in time. He said, you know what? I was so frustrated this week because I could not do everything I wanted to do. And I felt like I was a disappointment. And I had to check myself. And I told myself, you know what? I'm not that type of person that just wouldn't do stuff because, you know, I don't care about it. The fact is I have this condition and it prevents me from doing things sometime. And if I could do it, I would do it. And we all just started repeating that and everything. And that's right. If you really could do something, you would do it. But sometimes at some point in time, you just can't. And that, I think, is whether you have lupus or not. We're not superheroes. You know, even the best of the best and the people in the tip top shape, we all have limits at some point in time. And with lupus, you just have a little bit more than the normal person or the healthy person, whoever's considered healthy, whatever that's considered nowadays. But I think that's the most profound thing I've ever heard. And I want to share that with you guys. And I really want to encourage each of you to take that serious. Stress will kill you. It will kill you. You have to manage your stress in order to deal with lupus. And I know it's very, very difficult. Most people that I know were bossy, type A people. We take care of a lot of stuff. We're responsible. We're smart. We're a lot of things, but you have to learn to check yourself sometimes because stress will kill you. And that's what I can share.
I love that. Thank you. Adrian, did you see Mildred's hand up again or no?
I did not. Mildred, did you have something else before we end tonight?
Can y'all hear me?
Yes.
Mm-hmm.
Okay, I just want to tell Wendy that I understand tremendously what she's talking about because I've been through a stress the last few years with this because I got diagnosed with lupus right after I lost my son and my husband less than 6 months apart.
Oh
So
my gosh.
I've been under a lot of stress, and
Yeah.
I think that's what causes this to keep flaring up. And I'm trying everything I can research to find things that'll help me, you know, and everything, because I know stress is one of my big issues. But I'm like
Yeah.
you. I have always been a go-go person, and I feel like that I just have to, you know, I'm trying to learn to say no too right now. And it's not
Mildred,
easy.
Mildred, I'm so sorry for your loss. My heart really hurts to hear that.
Thank you.
And with stress isn't always physical, it's emotional. You've experienced two of the deepest losses a person could go through. Sounds like back to back. And
My
that does
son was
play a
killed by a
role.
drunk driver. My son was killed by a drunk driver, and my husband died of kidney failure.
I'm so sorry.
So it's just been hard. And I'm by myself. I live in Texas now, and my family, all my family's in Louisiana. So it's a little tough right now out here trying to deal with all this by myself.
There you go. That's the core. You know, that's the core of everything. And what I want to encourage you to do, I believe everybody living with lupus needs at least one person. And I want to commend you for coming on here today. I want to commend you for opening up and sharing this pain and this struggle. And I want to encourage you to connect to the Lone Star State. If you guys have a support group, I want to encourage you to make a friend. And if you need one, I'll be it. You know, everybody needs at least one person in their life that has lupus. You know, it's nice to have your friends and family. Sometimes they understand, sometimes they don't. And I know they love and care for you, but it's just something that transcends having a person with lupus where it takes a lot of pressure off of you to be able to talk to a person, you know, and it's not just that they can solve your problems, but just to be in your corner. But I want to also encourage you, just try to take one day at a time and not try to feel too wired up about it, but also take the time, you know, to try to care for yourself and your grief. You know, I think a lot of times when we go through things, you know, we try to push that to the side. I'm guilty of that too. Like, okay, I'm sad about this, but I don't have time for it. But you got to nurture yourself too for that, so that you won't feel that trigger, because that's a form of stress. It really is. And it's funny because in many cases I feel like, oh, I'm controlling this. I remember my uncle died this year, and he was my favorite uncle. He was the last piece to my father, and he died, and I didn't even realize like what he meant to me. And I started feeling myself feeling like I was having a flare up. I've been in remission for 13 years, but I felt it. Even though mentally I felt okay, the body is smart. It responds anyway. It says, hey, I'm sad. Hey, I'm not okay. And you have to give it the chance to acknowledge those things too and care for yourself.
Thank you.
Yes, and I'll send you more information through email about our support groups. I'll send everyone who's joined tonight information about our support groups. They are virtual currently. We have not gone back in person for those. But I like to go ahead and just end the discussion. I want to thank everyone for joining us and sharing your story. Thank you, Wendy, for joining us and sharing your story and your wisdom. We have so much to learn from you. And thank you, Angelia, for sharing the information about us and lupus. And then also that you are a lupus patient. So I want to thank our sponsors, GSK, Us and Lupus, and everyone have a wonderful night. And please reach out to the Lone Star chapter or any of us if you have any questions. We're here to help you and want to help you on your lupus journey. All right, everyone, have a good night.
Good night. Take care, everybody.
Bye, everyone. Bye-bye.